Today's workshop is the 988 Crisis Line, What Families Should Know. I'm excited to introduce you to Sam Sweet, Director of Mental Health Services at the Vermont Department of Mental Health, and Amy Guidice, 988 Implementation Project Coordinator. Thank you so much for joining us today. And with that, I will turn this over to Sam and Amy. Thank you.
Great. Thanks, Diane. Thanks for the welcoming. Welcome, everybody. Amy and I will introduce ourselves in just a second. We just wanted to say that we're going to provide you with an overview of what 988 is, what you would expect if you were to reach out to 988. And we want to thank you for sending some of your questions ahead of time, as we were able to incorporate some of those questions into this presentation. Amy and I spend a lot of time with 988. We kind of live it every day and implementing it. And so we know we can't see it from every angle. So we absolutely want you guys to speak up at the end, ask questions. We want to know what the general public does not know about 988, so that can help us with building our communication plan to get the word out about 988. So as Diane said, we built in time at the end for Q&A. We welcome you to come off mute and ask questions, but if you don't feel comfortable with that, please post them in the chat and we will get to them at the end. All right, next slide. Great. So as Diane introduced us, I'm Samantha Sweet. I'm a licensed clinical social worker. I work at the Department of Mental Health as the Director of Mental Health Services and have been at the department for almost 5 years. Prior to that, I worked in community mental health agencies for almost 20 years. And I will turn it over to Amy Guidice.
Thanks, Sam. As both Diane and Sam mentioned, I'm Amy Guidice, and I'm currently working as the 988 Implementation Project Coordinator for the Department of Mental Health. I've been working with the state for about 17 years, and I've been with the department in various roles for about 10 years, 12 years, I believe. So I'm happy to be here, and I'm looking forward to sharing 988 and hopefully learning from you as well.
Next slide. We got to get into the pattern of doing that. So we're going to jump right into things. And why 988? Why are we bringing it to Vermont? Why is this so important? We're going to talk about this throughout the presentation today. And so we all know, we have probably all heard this before, that suicide is a preventable public health problem. And you'll see here some statistics as to why we're looking at 988 now. So in 2020, there were 160 visits per 100,000 residents in Vermont to Vermont hospitals for intentional self-harm. And then in 2021, there were 142 suicide deaths amongst Vermont residents, which is a record high for Vermont. So now is the time implementing 988, and this is one of the biggest reasons why now. Also in 2021, suicide was the 9th leading cause of death in the state. Next slide.
So Vermont in 988, from distress to crisis. I'm going to talk a little bit about what is 988 and how 988 works. That will be the bulk of the rest of the presentation. So the Lifeline is a national network of over 200 local, independent, and state-funded crisis centers equipped to help people in emotional distress or experiencing a suicidal crisis. Moving to 988 did not replace the Lifeline. It created a once-in-a-lifetime opportunity to strengthen and expand the existing National Suicide Prevention Lifeline. Beginning on July 16th, 2022, people could begin accessing the Lifeline via 988 or by the previous 10-digit number, which will not go away. We know that the ideal crisis response system includes someone to talk to, someone to respond, and places to go. 988 is an important component of someone to talk to. 988 is more than just an easy to remember number. It's a direct connection to compassionate, accessible care and support for anyone experiencing mental health related distress, whether that is thoughts of suicide, mental health or substance use crisis, or any other kind of emotional distress. Next slide. So here's a timeline of the history of 988 and how we've been building on the existing National Suicide Prevention Lifeline. In November of 2018, Northwest Counseling Support Services signed on as Vermont's first National Suicide Prevention Lifeline Center. Then in February of 21, Vermont received a 988 planning grant and built a 988 planning coalition to develop an implementation plan for 988. In June of 2021, NKHS, Northeast Kingdom Human Services, began answering calls as Vermont's second Lifeline Center. And then, like I said in the previous slide, in July of 2022, the 988 dialing code was launched, along with chat and text. Next slide. So between February of 2021 and now, guided by SAMHSA and Vibrant, we've worked to develop a plan that includes 8 core areas of implementation. Each core area included various action items and goals and required putting together a pretty extensive stakeholder list. So we have the 8 goals are ensuring statewide coverage for 988 contacts. That's calls, chats, and texts. It's making sure that 988 is available everywhere in the state. Securing adequate, diversified, and sustained funding streams. Expanding and sustaining center capacity to maintain answer rates for current and projected volume. It's a lot of buzzwords, but basically just making sure that we build the capacity within our Lifeline centers so that we can answer the most amount of calls for Vermonters. Knowing that with the release of 988 and expanded messaging, the call volumes will increase. Vermont supports centers in meeting Lifeline's operational standards, requirements, and performance metrics, and that's the quality aspect. We maintain a comprehensive, updated listing of resources, referrals, and linkages. We ensure centers can provide best practice follow-up to all 988 contacts as appropriate. Plan and implement messaging for 988. And convene a coalition of key stakeholders to advise on 988 planning and implementation. Next slide. So just to dig in a little bit as far as the who in regards to 988, who's been working on this. So we had a goal to convene the coalition of stakeholders. So this coalition pulls together a variety of individuals representing different perspectives, needs, backgrounds, to work together to develop a phased and flexible implementation plan that considers the needs of all Vermonters. I think the key here is with diverse representation. So a stakeholder's primary role is to help a project meet its objectives by contributing their experience and perspective. They can also provide necessary materials and resources, and their support is crucial to a successful project. So who are the stakeholders for the 988 Planning Coalition? It is quite an extensive list. I think toward the end we ended up with 26 or 27 members of the coalition, and it included the Department of Mental Health, the Department of Health, EMS, NAMI Vermont, Vermont Care Partners, Vermont State Police, Public Safety Answering Points or Dispatch Centers, Vermont E911, Emergency Dispatch, the Vermont chapter of the American Foundation of Suicide Prevention, Vermont Lifeline Centers, the Centers for Health and Learning, the Vermont Suicide Prevention Center, individuals with lived experience, advocates, peer service providers, the Agency of Human Services Abenaki Equity Work Group, and the Vermont Multicultural Work Group. Next slide. The first phase of 988 implementation is complete when we launched on July 16th. Through dedicated stakeholder engagement and the diligent work of our Lifeline Centers, Vermont was ready for the 988 launch. Our centers have maintained 24/7 statewide coverage while answering over 90% of all calls from Vermonters in state. So what now? Now we're working to build capacity for 24/7 coverage and chat and text response. We continue to work with our coalition and stakeholders to ensure that all voices are heard and that 988 is truly a tool for all Vermonters. Next slide.
Forgot I had to go off mute. Thanks, Amy. Sorry, I'm just getting over a cold, so every now and then you'll hear me clear my throat. So how is the 988 different than 911? We'll talk about this, and then we'll also, our next slide, we'll talk about how 988 is different than local crisis centers, our crisis lines. So 988 was modeled after 911, which is an easy 3-digit number that everybody can remember. But they are two very distinct and different resources. And of course, our general counsel, our lawyer, always wants us to remind people that you always call 911 for any sort of medical emergency. But 988 is there for a different reason. And so Lifeline counselors are trained in order to help callers that are experiencing a variety of mental health challenges and issues. This process includes a risk assessment, which allows the counselor to assess the risk of harm to the caller or to other people. If the caller is at imminent risk of death, the counselor may include the help of law enforcement. The department is working alongside peer advocates and individuals with lived experience, like Amy had noted just a couple minutes ago, to create a system of care which keeps consent at the forefront of all who call 988. Consent is really important for everybody that's involved, the coalition, peer advocates, individuals. It is definitely at the forefront of every conversation that we have. So you may have heard also about 988 being able to geolocate callers. I don't think I've ever said that word more than I have in the last 6-9 months. However, currently Lifeline counselors are not able to geolocate callers. Lifeline counselors are not, like I said, able. I'm getting a message that my internet is unstable, so let me know if you cannot hear me.
It's a little choppy.
And since, again, if this Vermont call centers began taking calls in the summer of 2021, over 98% of calls required no further emergency intervention. So police were not notified, 911 was not called. It's also important to know that while counselors are trained to provide intervention and building rapport with all emergency services, if there is an imminent risk to life and safety of the caller or to another individual. So we really can't stress that enough, that confidentiality is super important to everybody, and we will only call if it is an imminent risk. Okay, next slide. So this is a question that we get asked by many. How is 988 different than local crisis lines? So our local community mental health centers. And while anyone can contact the local crisis lines, many people don't know about them. Many people don't know about community mental health agencies, or they know of maybe only Howard, because it's the biggest community mental health agency in the state. But each county has a community mental health center that has a crisis line. And often the way we describe it is, if you are receiving services from a mental health agency, or you have a family member that's receiving services, calling the local number may be part of your treatment plan. And so we want to have you to be able to access the local crisis line as part of your continuum of care. 988 is still on the table for anyone and everyone. So even if you are receiving services at a local mental health agency, you can still call 911. The biggest difference too is how I describe it is, if you are calling a local mental health agency and you're looking part of the conversation and you need a homeless shelter, the local mental health agency crisis line can give you the number and say, talk to Jim when you get there, he's the director. The local agencies know those ins and outs of local resources, where when you call 988, they know about resources and can direct you, but they won't know, like, talk to Jim, he's the director and he can get you in, or anything like that. So they are really there for support and guidance and referrals, but not to the local level that you could receive from a local agency. Okay, next slide. Again, we want to really emphasize that support is available to anyone and everyone. So if you take anything home or take away from this presentation today, it is that help is available, and that anyone, anywhere can call, can chat, or can text 988 to receive the support. And this is just showing that 988 has proven to work. It's nationwide. So we want to encourage you. You can call. Amy was just telling me the other day how she texted 988 just to see how it would work. And so if you are feeling a little nervous about contacting them, you can contact them and do a run through and see how it's going to work. So when you do need them, you know what to expect. Next slide.
Thank you. Yeah, I did text 988. I did not know exactly what happens when you text 988. I've been working on this project for 2 years, but I had never seen it actually in action, and I wanted to make sure that I was giving you guys the best information. So I did text 988, and it was helpful because now I have more working knowledge of what they will ask and what they will do. So if you are somebody who may not be using calling, chatting, or texting personally, but you are using it in your role as guidance or helping somebody else, and you want to know what it looks like before you do that, feel free to go ahead and do that and just let them know that you're doing it for informational purpose because you want to be able to share the resource with friends and family. So for the next few slides, I'm going to go through ways to contact the Lifeline and what to expect. I'm going to jump around a little bit between the three options, but like I said, there's three options. You can call 988. You can send a text to 988. Or you can go to 988lifeline.org, and in the top right-hand corner, you can start a chat. So for calls between August of 2021 and August of 2022, Vermont Lifeline Centers have answered over 4,500 calls, with an average of 582 calls per month since the release of 988. And we did see a significant jump in call volume following the release on July 16th. Next slide. For chat and text, we currently have the capacity with our Lifeline centers in Vermont to respond 32 hours a week, building to 24/7 response by July 1st of 2023. Right now, our centers are responding to chats and texts in what we call the national queue. So when anybody chats or texts to 988, they're added to a national queue. And so they're pulling chats and texts from all over the world, really. And they are working to transition to local response. So hopefully within the next few weeks, we will have Vermont centers responding to Vermonters. So between August 21 and August 2022, Vermonters have initiated 638 chats and 361 texts. And the monthly averages since the release is 97 chats and 85 texts. So it is important to note that chat response is based on the zip code entered during the pre-session survey. And we'll get into that a little bit. Next slide. So digging in a little bit deeper into how 988 works for calls. When you call 988, you're given three options. You can press 1 to connect with the Veterans Crisis Line. As a veteran, you do not have to press 1, but you can press 1 to connect directly to the Veterans Crisis Line. Press 2 to connect with the Spanish subnetwork. And then, or you can remain on the line and be connected directly to a Vermont Crisis Center. So the way calls are routed to a Vermont Lifeline Center based off the caller's area code. So 802 area codes get routed to Vermont centers. If you have an area code other than 802, in this day and age with cell phones, a lot of people do, you can still call 988 and you'll be routed to a Lifeline Center that corresponds with your area code. All Lifeline centers do have the ability to transfer calls to local centers. So if you have a 413 area code, you will get connected to a 413 center. But if you would like local resources, they can help you transfer to a local center. Next slide. And now digging into chat and text, there's a couple of options. When you use chat to connect to 988 through 988lifeline.org, you'll select the chat option on the top right of the page. You'll complete a pre-chat survey to accept the terms of service and be connected to a counselor. The pre-chat survey includes information such as zip code, a name or alias, age, gender identity, main concern, thoughts of suicide, and then an optional consent to follow up. Once you complete the pre-chat survey, you'll see a wait time message while you're connected to a crisis counselor, and the counselor will answer your chat. Sometimes, as the network is building capacity for chat and text currently, that wait time may be a little bit longer. And if that is the case, you can always end the chat and just call 988. When you text 988, you'll receive a welcome message with information on connecting to the Veterans Crisis Line directly, should you choose to do so. You will have the option to reply yes to accept the terms of service and be connected to a counselor. So before you reply yes, you're not actually connected to anyone at that time. You'll complete a pre-text survey, which includes information about your thoughts on suicide and level of upset. The counselor will then answer your text. Chat and text right now is only available in English. Next slide. I'll pass this one to Sam.
Great. Thanks, Amy. So I'm going to speak to the Lifeline Centers. As Amy had mentioned during her timeline, we have 2 certified Lifeline Centers available to call. And so one is Northwestern Counseling and Support Services. You'll hear us refer to it as NCSS. They provide 63 hours a week and receiving 38% of the calls. And then East Kingdom Human Services and KHS provides the bulk of the hours at 105 hours per week, and they receive about 62% of the calls. What we are seeing is that majority of the calls are placed during the evening, night hours as people are out of school, out of work. It's the nighttime. We know nighttime is usually the hardest time for people. And that's what we're seeing, is the call volume is the highest at that time. We also have a third contract, and that's called Headrest, which is in New Hampshire. And it provides a 24/7 backup coverage for NCSS and NKHS when they're unable to respond to a call. So NCSS may be covering the hours, but they could already be on the line. And so a call may be bumped to Headrest to answer. So when Headrest is not available, they're on the line too. A national backup center is available to pick up calls. So there will never be a call that goes unanswered. But it's also important for you all to know that 90% of all Vermont calls are answered within Vermont. So very few are going to Headrest, and even fewer are going to the National Backup Center. All right, next slide. Again, we are going to drive this home today, that Lifeline counselors are trained. They're available to anyone at any time. We use the phrase a lot with promoting 988, that it's stress to de-stress. So it's a continuum, and to show that you don't need to be suicidal to call 988. We actually want you to call before you get to that level of having thoughts of suicide. We want to prevent you from getting to that level. So we encourage people to call even if they're feeling stressed. And so this slide is really highlighting how important it is just to reach out. Even if you are struggling with any of these things, you're feeling distressed with emotions, you're having stress from work, substance use issues, 988 is there. All right, next slide. So 100% of callers that express suicidal ideation within either the last 24 hours or are currently expressing suicidal ideation are asked if they want a follow-up call before ending that current call. And what we saw from January to June of 2022 is that 26% of callers were offered follow-up calls. And of those, 14% accepted a call within 24 or 72 hours from the Lifeline Center as a follow-up call from their initial one. Next slide. This is our last slide. We really put this in here to show you additional resources that you can tap into. And we have shared this PowerPoint with Vermont Family Network, and they're going to be sending this out. So you'll have these links available to you. And we thank you for coming to the presentation, and we would love to hear questions or thoughts or what we missed. We're trying to really get the word out about 988, and so we'd love to hear feedback.
So I see one question in the chat. It says, do the Lifeline Centers refer to local agencies for ongoing treatment?
Yes. So, Amy, do you want to talk a little bit about their resources that they have on hand?
Sure.
I got a cough.
Yeah, one thing that I want to clarify, that when we talk about Lifeline Centers referring to local agencies, they're not doing a clinical referral. They're providing information about the other agency to the caller. So our 988 Lifeline Centers have worked with Vermont 211 to create a database that's part of the comprehensive resource listings that I spoke about earlier. And in that database includes a lot of, probably all of the 211 resources, as well as resources that might not be on 211 that they want in the 988 databases. I believe 211 does have some types of resources that they don't include in their database that 911 does. And then, of course, the 988 call takers have all of the local crisis lines and all of the community mental health agencies numbers to provide.
So we have another question. And I also, if people would like to ask questions outside of chat and ask it live, that's fine too. So this question is, if someone calls, texts, or chats, what's the average wait time?
Do you want me to take this, Sam?
Sure. I figured you'd answer, so I wasn't even going to unmute.
Okay. I don't know the answer to all of those. I do know that with calls, that there's usually not a wait time. So if it's if somebody calls 988 and they go through and they're routed to Vermont, by the time a Vermont center answers the phone, it's usually about 40 seconds. So that's, and the standard and target for our centers is to answer within 6 rings. So that's pretty quick. If the line is busy and the call rolls over to headrest, it adds some more time, but it's seconds, it's not minutes. Chats and texts, I'm not sure about. I can look into that and I can provide information back. We are, like I said, we're not answering on the local queue right now. So all chats and texts from Vermonters are going into the national queue, which is also working on building capacity. But I can look that information up and get it back to Diane if that's something that would be helpful.
Sure, and we can include that in the materials that we send out after the webinar.
Okay.
Is there anyone that would like to ask a question live, or if there are other questions that people want to add to chat? I'll give folks a minute to think about that. And I have a question. You talked about the stakeholder group, and it sounds like it's a very diverse group. A lot of people are involved. If there are Vermonters who've experienced 988 and want to provide feedback, whether they're peers or families or friends, is there a way to provide input into that stakeholders group, for ongoing quality
improvement? Yeah, absolutely. And we want to hear that. We want to hear feedback. So there's no, Amy, correct me if I'm wrong, but there's no formal way of giving feedback yet. We would like, both Amy and I are the contacts for the Department of Mental Health with the 988. And so please reach out to us if you are hearing anything, and then we'll talk it through with you if it should be brought into the coalition or not. And then we definitely want to make it a quality improvement process. We know everybody is doing their best out there, and they're reaching out, hopefully, and sorry, I gotta shut off the chat. It distracts me. So we want to hear how things are working and how things are not working, and or if it's taking 2 minutes for a phone call to be answered, please tell us that feedback. We are always trying to improve the process. We work really closely with SAMHSA and nationally to see what's going on in other states, what's working, what's not working, troubleshooting. So we really built this this model, kind of, what's that saying, building the plane and while it's flying or something like that. And we feel like we did that a lot. And so that we're completely open to hearing feedback, and we want to know how to get the word out. We want people calling 988.
Thank you. Does anyone else have any questions? I have another one.
Yeah.
That's been, can you talk a little bit more about coordination from state to state? With the, like, I think you mentioned this, with cell phones, there are so many different area codes, and people can, be calling with one area code, but be in another state. And I was curious, and others might wonder too, how you coordinate that process and resources and all of that.
Do you want to start, Amy, and then I'll jump in?
Sure. So we've been really lucky that with 988, we have a national administrator of Vibrant Emotional Health, and they have provided a whole bunch of technical assistance and support research materials. One of the things that they've released is how to do a warm transfer between states. So all states have guidance on step-by-step how to do a warm transfer and how to manage that. So everybody knows what to expect and everybody does it the same way. If there isn't a warm transfer that happens, I do know that some of our Lifeline centers have had to provide resources to other states, to people in other states, because if you have, like I said, if you have an 802 area code and you're in Texas and you call 988, you're going to reach a Vermont Lifeline Center. So they have been very creative and working on how to find resources and materials for the people in that state that they're actually in and calling from. A lot of the times people are just calling to talk, so it's not as relevant that they're in the same state, because they don't want resources, or they just need some help with de-escalation, and any Lifeline Center can do that.
Thank you. We did have a comment too, just to let you know about how helpful this was, and appreciation and thank yous. So I'm not seeing any other questions in the chat. One last call for questions from participants. And okay, well, I would like to say thank you, Sam and Amy. This information was really helpful. I know that I learned a lot. And for participants today in the workshop, you will see a link to the evaluation in chat that has been posted. If you could please take a few minutes to complete that so we can make improvements and fulfill our grant requirements. We have many more interesting workshops coming up, and you can find details about those on the homepage of our website, vermontfamilynetwork.org, along with the links to the previously recorded ones. We have tons of information on our website, and getting connected with us is easy. You can follow up on Facebook or join our closed Facebook group if you are a parent. We have 2 closed groups, one for all parents of children with disabilities or special health needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel. We're here to help. Please contact us by phone or email. Thanks again, everyone, and have a wonderful afternoon. Thank you.
Thanks, everyone.
Thank you so much.
Thanks, Diane.
Thank
Bye-bye.
you. Bye-bye.